am honored to welcome Rita. Rita is a longtime perioperative nurse whose years in surgical medicine gave her a front row seat to both the brilliance and the limitations of modern healthcare. Through that experience, she became deeply aware that while medicine often treats the body, healing asks us to care for the whole person, mind, body, and spirit. That calling led Rita to expand her practice into integrative and holistic care, where she now combines her nursing background with hypnotherapy, faith based healing practices, and intuitive insight. She is passionate about helping people reconnect with their own inner wisdom, their spiritual roots, and their capacity to heal. Today, we'll talk about fear, mortality, fragmented care, and what becomes possible when we return to whole person healing. Rita, welcome. I'm so excited about this conversation.
Thank you. I'm happy, so happy to be here. Like the line, so I'm excited.
Yeah, all right. Welcome to the Calm Collective Conversations, where we explore hypnosis, nurse led coaching, and the mind body connection in everyday practice. I'm Christy Cowgill, nurse anesthetist, psychiatric mental health nurse practitioner, and board certified hypnotherapist. If you've ever wondered what's really driving behavior, what creates the conditions for self healing, or how lasting change actually happens, you're in the right place. Let's get going. It is so great to just be in your presence and to have this organic conversation with you. And I'm really curious if you can remind me and tell our listeners about your journey into nursing and maybe what first called you into surgical care or the perioperative care area.
Well, I've been a nurse for getting close now to 40 years in all aspects of nursing, but surgery seems to be where most of my nursing care has landed. And I kind of laugh because a lot of sometimes you think about you see yourself in a different space, maybe being earlier in your childhood. And I remember I'm dating myself, but there was a program that used to be called Schoolhouse Rock years ago that
Yeah.
used to teach kids and about medicine, about history and things like that. And I remember the science one. They had a spaceship, and the guy was going through the body and talking, seeing different parts of the body talking to each other. And I remember, I don't know how old I was, 7, 8, 9, wanted to be in that spaceship because I thought that was so cool that you get to see the inside of the body. So now I laugh because that's exactly what I do today. I'm a surgical nurse. I see the inside of the body every day. So I think
Yeah.
that was something that came into fruition.
Oh, I love that. And I also remember watching Schoolhouse Rock. So here for any of our listeners who can remember some of those episodes, I think that always reminds me of the colonoscopy one where they're taking a tour of the intestines, right? All right. If you're a nurse, if I'm so curious, was there a particular patient encounter or moment that kind of shifted your understanding of healing in a way?
I'd say absolutely, because I think in nursing school, you're taught this perfect way of nursing, and then most people go into that field because they care about people. And my very first job was in postpartum night shift. I've been there, I don't know, maybe 8 months now. So now I'm in charge. So I don't have a lot of patient direct care because I'm in charge. So it'll give me patients that don't require a lot of my attention. One of my patients at that time was on Mac sulfate because she had hypertension. And with that medication, since it has a lot of problems with sight and the lights bothering you, she had the room being dark. And I remember just making rounds. She was a young girl and she was crying and asking me, could I please stay with her? And in the back of my mind, this is my first job. I'm like, I don't have time to stay with you. I'm a charge nurse. I got to go see what's going on outside. And although I could not stay, I felt such a divide. I said, this is not what I thought I signed up
Mm,
for. And in fact, I was really struggling about leaving nursing because I felt like the whole thing maybe was a lie. I didn't know how to deal with those feelings, but I already saw it right then with that
yeah.
first step.
Yeah, I think especially to our nurses who might be listening, that moment where there's that dissonance, like we're called to be with the patients in their moment of need. And your role was competing with that, right? Your role as being a charge nurse was taking you away from that, even though your intuition said that's what she needed. She's actually asking you for what she needed. Yeah. Wow. I'm glad that you can give some voice to that shift and realize that is what helped you pivot. And I know that you still work in surgery, but you've taken a different perspective likely since that incident, right? Since that client. And part of our talking before this, I know that you really have this belief like that healthcare, it's so fragmented that it fragments the human being. So I'm curious if you can just tell me, what do you mean by that?
I think just I work in a teaching hospital. There's a lots of departments and a lot of specialists. And just by the mere fact, in so many ways, that is how medicine is designed. In fact, it's actually a thumbs up situation. Oh, you're going to this hospital and they do XYZ, they do this technique. But I've always wondered, and I think I was called into this setting because I would always wonder what happened to the patient when they were off the table or what brought them in here. None of that kind of comes into play. And usually we send them off. I have no idea what happened to them, what got them here. And there is that always bothered me in my head is to make me think about was there some kind of thought previously that now you've landed up in the operating room on this table with that heart attack or whatever? And
Mhm.
I don't think that is even addressed in this arena at all.
Yeah. And I guess that's an unfair question. Like when I ask you that, like, why does medicine or our system kind of separate mind, body, emotions, and spirit, right? It's likely because we're tending to the body when we're in the hospital. So I'm curious to pick your brain a little bit here. And what would, true whole person care look like for you? Like, how would you describe whole person care, especially in the hospital or like in the surgical setting?
Well, it's interesting you say that because that's actually been a goal and kind of a fun thing that I've been trying to do to challenge myself because my encounter with my patient is very brief. I'm usually coming out there to meet them, make sure we're all on the same page. I'm doing my interview, make sure that they understand why they're here, what they can expect when they come in the operating room. I think that's a big piece of it also because I spend a lot of time telling them what they expect because usually most of them come with a lot of fear. And this is a very strange place. It's scary for even sometimes the medical people. You got these people walking around with masks on like they're going to get you or something like
Yeah.
that. So just allaying those fears. And often I've been challenging myself because it is a brief time that I've actually done deep breathing with them so that I can connect them with their body and remind them that they are built. I like to call it fearfully and wonderfully made because just like we hear all about the anxiety and stress and fight and flight, you also in that very same system have calmness and peace.
Yeah.
And it's a matter of let's tap into that part and this part. So I wanted to help them to be empowered even in
Yeah.
a brief time. So that's been a personal goal for me to see if I could do that in those moments of those little windows of moments that I have with them.
I love that. And what did you call it? Fearfully,
Fearful, oh, that's one of my theme scriptures is that we are fearfully and wonderfully made.
fearfully
So
and
as you
wonderfully
look at
made.
all of those things in yourself, the yes, that fear is there, but we also have wonderful things in us to counteract the anxiety that it's built in you as well. And it's
Yeah,
a matter of you to tap into those powerful forces that you have within yourself.
absolutely. I love that. I love that the fact that you brought some scripture in there because I know that is really important to you in your own personal life. And I'm curious if you can lend some perspective of how can nurses, right, honor their patient's spirituality without crossing boundaries or imposing any beliefs. So it seems like you have some skill there. How do you do that? Because not everyone you interact with is going to be faith based or even your own faith. So, how can you or how have you learned to adapt these strategies to really honor that person's own spiritual path?
One of the big things is, again, to have them to look at themselves and to see the powerfulness that they have within themselves, their breath, how that they were made. That's literally inside of you. I was talking to someone this morning about the vagus nerve. Just, do you know that you can switch that on? That you have the power to do that. And as you start to think about those thoughts ahead of time, and even while you're waiting to be rolled into the operating room, you in touch with a bigger power than other than yourself to be calm. And so I've heard patients as I'm scared, can you pray with me? And then that opens up a door for that type of spiritual attention to them and nurturing. So I go with what they say, and it's become fun and hopefully comforting to those who I interact with.
Yeah, I can hear that in your conversation. And I know that when we enter into the healing profession, when we help others, something inside of us usually changes as well. With you being on this journey, what have your patients taught you about faith, about surrender, about healing? What has this vocation taught you about those three topics?
I think obviously to trust in a bigger power. Some of the patients and some of my clients that tell me they're going into surgery, they want to be assured that there's a spiritual edge that maybe they can take with them, an image that they can take with them, that even though this is a very foreign world to them, that all of these sounds are very strange and can be very scary, that their faith supersedes all of that. And often when they are going to sleep, I whisper those things into their ear because as a nurse, my job requires me to stand by them when they are being put to sleep. So I think it's a perfect time. I have a perfect audience, and I say sometimes little silly or smiling things to them when they go to sleep. Oh, you're going to be beautiful, or we'll give that gallbladder love on its way and thank it for what it's done for you. That my colleagues laugh at me because this is who I am. Patients connect with that.
Yeah.
I It kind of calms the room and calms the thoughts because yes, you are in this foreign space, but you are so much more above it, and so much of you can be calmed down, and you don't have to focus on all this externals, that you actually have the power within you. And I'm hoping that I can help you to tap into that.
Yeah.
And therefore me as well. So I think that's what they teach me because I'm dealing with that every day and some of the stresses that come with the environment I'm in. And it reminds me of the same.
Yeah. I love that. I love that you're using a little bit of humor. And what I'm hearing is a different approach than sometimes our routine, sort of scripted things that we do in the operating room. And you're connecting with them and allowing them to get a sense of safety, a sense of control, and empowering them, right? Which is the beauty of knowing hypnotic languaging, right? And being wise to the fact that people have their conscious mind, what we're usually seeing, what people are talking with, and that subconscious or unconscious mind, which is where all their feelings, their beliefs, their values are. And you're whispering in their ear and you're speaking to that mind that is below the surface, right? That we sometimes don't see if we're just listening to what people are saying. You're connecting with them on a beliefs, on their value system, and an emotional level by just using your
Absolutely.
words. Yeah.
Absolutely.
And so I'm curious, like, then in your experience, because fear is an emotion, right? And I know because of my years in anesthesia and because of your years in surgery, right? People are really afraid
Mhm.
in the OR. And oftentimes when you ask them, they're really afraid of what if I don't wake up?
What's the
Right?
big
So, what are people really afraid of?
There's so many things that they could be afraid of that I don't wake up. What's going to happen while I'm recovering in my family and all of the commitments that I'm in, the responsibilities that I have to have. What's my going to be my post-op diagnosis after this surgery is over? there are so many fears that kind of come into play, and how am I going to be on the other side? And this work is very much, it draws to me as far as the words are concerned, also because I believe words are very powerful. I've often believed that even before I got into hypnosis. And healing starts with feeling safe. So that is something that I help them to try to get that feeling, even in the operating room, as
Yeah.
you see that you're going to be safe. You're going to be in this situation. And that starts with the mindset that you have a positive mindset about your outcome, that your body knows exactly what it needs to do in order to heal, and that it's going to be fine. And that whatever is meant for you is going to be there. Your journey, you get to set the dial on the television and let your, I guess we're doing a lot of future pacing, because can you see yourself on that, on the other side of this?
Yeah.
How much more you're going to be? This is past you, you're active, you're enjoying your family. These are kind of things. And I try to say them. And again, it makes me laugh and it challenges me because I do have a small window of time. I sometimes don't see you again. There are sometimes I do see people come back and I tease them and, oh, you should just come and let's have coffee. You don't have to have surgery to come visit with me. Just come, let's go out. But that they hear hopefully healing and compassion
Yeah.
will make them to move forward.
Yeah. So what I'm hearing you say too is like people are just more or less afraid of that loss of control or that unknown, right? That uncertainty. And by you just really engaging them in their breath is bringing them right back into this moment. You mentioned the vagus nerve and taking a deep breath, and
Hmm.
that is our light switch, if you will, to bring us back right into the moment because it's something that is right here in the present. All those other fears are in the future, right? And then once you give them their breath and help them to take a deep breath, then you can actually start to change the direction of where their thoughts go. So instead of being afraid of losing control, you start to help them to see at the end of this how amazing they're going to feel. And I love that you're infusing that too with a little bit of humor because that silly gallbladder, and maybe you name it, is going away. But more importantly, you're really crafting this imagery for them of the healing. That is what I'm hearing from you is that's the key to giving them some power back.
That your body is not your enemy also. And that's
Yeah.
one of the reasons why I said that to them, because of course they're thinking if they're there for cancer that, that there is a fight against your body. Not that you're at war with yourself, that what can you learn from this? What can you do? We're going to send that body part. It served you, and we're so grateful that it served you. Now we're going to send it off with some love
Yeah.
and thanking it for what it has taught you, what it's given you during that time.
So, Rita, as we're putting a pin in this conversation, and there's so much more depth that we can go into, but just for the listeners, right? And the listeners might be nurses, they might be patients, they just might be people out there, right? How can that listener begin to reclaim their own healing power today? What is the simplest thing and the simplest way that they can, or what can they do to reclaim their healing power?
I go back to what I said before is understanding and loving yourself that you are not your enemy,
Yeah.
and that whatever has come up for you, be it an illness or something else like that, can you learn something from that? I like to play the reframing game. What has this information brought to me? Sometimes it takes a minute to do that because we are slighted with so many negative images and things like that. But as you look at it and take a different approach to it, you may find that you have much more insight and incredible personal power as you reframe your thoughts in this situation, which is a wonderful thing that I think hypnosis does because it helps us to look at our thoughts.
Yeah.
And more importantly, take those thoughts and shape them into who we want to be.
Yeah. Instead of being hijacked by those thoughts of making
Yes.
us play small or be in the fear game or Instead, we can shift our thoughts to the things that we really desire or reframing it.
Absolutely.
And I love that you mentioned that because often a lot of the work that we do when we know the hypnosis and hypnotic approaches is reframing. And we're using a softening, if you will, or a relaxation of the person, a calmness in order to offer that reframe. Because if we were to offer a reframe when somebody's really anxious, they're not going to listen, they're not going to hear it.
So,
So, one of the easiest, simplest techniques is to find your breath and use that vagal nerve to shift into more of a parasympathetic, if you will, nervous system where a reframe can be considered. So the client can be like, oh, yeah, what is the gift here? Or what I'm going through all of this and it hasn't happened to me, it's happened for me.
what's the possibility in that? Because
What's,
a lot of
yeah,
times our thoughts are so concrete and lock the door.
yeah,
And that's why I guess I asked that simple question, is it true? Because, and is
yeah,
it always true? Because if you really answer that, not really.
yeah,
There is definitely a side B
yeah,
if you allow that to be.
right.
Nothing is that concrete.
Yeah, because if you allow that belief to be true for you, like really true, then what does
Yeah.
that make you? So I love that. I know that you were drawn into hypnotherapy as a nurse. And so part of the stuff that you've talked about today, the breath work, the reframing, the future pacing, those are all kind of hypnotherapy techniques. And I'm really curious to hear from you, Rita, because you are an expert at being able to deliver this in a way where people don't even realize that you're using hypnosis, if you will. So it's really just become part of your language pattern, your ability to connect with people. How do you find that hypnotherapy really complements our traditional medical model?
I think one of the basic things and the drawing card for me is simply the power of words. That has been very sobering to me and
Mm,
allowing people to even hear what they say. I remember working with someone different aspect, but her husband did some long line fishing in Alaska and he hurt himself. And so now she had to figure out ways that she can do her, that we, she can provide finances to the home. And we were talking, and she was just saying, I feel like I've got the weight of the world on me. I've got the weight of the world on me. And then, of course, and a few later in our session, she ended up having rotator cuff surgery. And it
oh,
just befuddled me as did you hear what you're saying?
yeah,
That she had been already saying that the weight of the world on your shoulders. Did we open the door some way? So
yeah.
sometimes we don't realize what we say and that we put it out there that have we, I won't say signed a check, but maybe not in ink, but at
Yeah,
least that maybe we can use an eraser to get rid of that.
I
So
love that. So what I'm hearing is that as a hypnotist, as a hypnotherapist, one of the things that you do is you mind your words and you use those with purpose, but also you're listening for your patient's words and for your
absolutely,
client's words. So I think that's a great opportunity for us as nurses, as nurse practitioners, as doctors, as healers to start to listen differently because the client might actually be telling you something like the weight of the world is on my shoulders and letting you know what their problem is without even knowing what their problem is, right? There's a deeper knowing. There's an
absolutely.
unconscious knowing, but it hasn't made it to its the conscious mind yet, right? Yeah, I love that because that rings so true for my lived experience as well. Like, I feel like when I learned hypnosis, it became a skill of how I can communicate, but also how I could listen.
Absolutely.
Yeah. Yeah. And so right now we're talking a little bit more about just conversational hypnosis or listening ear hypnosis, I guess. We're going to coin that the hypnosis ears. But there is a more like clinical hypnotherapy where we really do guide clients for different things, such as when they're getting ready to face surgery or facing a diagnosis or in grief or in end of life anxiety realms, right? Which is definitely where your strength is because you're so connected to that spiritual component. Tell us a little bit more as how hypnotherapy can really help in those realms.
I love words. So the first word that came to me, that is one of our words in hypnosis, as well as I believe the answer is an anchor.
Yeah,
So it gives us an anchor. We give anchors as we do hypnosis with people so that they have something to take with them to keep them in that space.
yeah,
And that's what I believe that they need is having an anchor.
yeah,
That anchor keeps you just like a boat from flying off the handle. That even though, the boat rocks, but it doesn't go all the way away.
yeah.
And so I think about that in a visual sense, metaphorically, an anchor, as well as just physically, what that does for you and helping them to find their anchor.
I love that. I love that as a metaphor. So if anybody is feeling like there's a time in life where your boat may be like lost at sea because it's maybe rough seas or there's a storm coming, that hypnosis becomes an anchor. It becomes a tool that you can stay steady amid a summer storm, a winter storm, our big waves, right, out in the ocean. You might rock a little bit, but you're anchored. I love that. Rita, thank you so much for this conversation today. There's so much more dimensions about you. Like, we didn't get into kind of your medical intuition perspectives and we didn't dig deep into the spirituality. So I hope you'll come back for another conversation with me.
It would be my pleasure. It's been a delight to spend this time with you, and I look forward to future times.
Awesome. Good to see you again, Rita.
You too. You too.
And also, shout out, Rita and I are both members of the Calm Collective Care team. So reach out to us if you want to learn more about hypnosis or you want to be guided in hypnosis practice.
Absolutely.
If you're curious about hypnosis, nurse-led coaching, or exploring the Calm Collective Care team or our audio library, just visit our website at www.calmcollectivecare.com. That's Calm Collective Care, all one word. We offer individual sessions, group sessions, and our growing library of guided experiences. If this conversation sparks something for you, share it with a friend or another nurse who might benefit.